Hi, I'm Nirav Shah. I'm the medical director at ADOC Medical Group. So you may have been diagnosed with COPD recently, and you may be scared and don't know what that means. I'm here to help you understand what COPD is and help you manage your condition. The reason we combine COPD and asthma is because they have the same symptoms, and most importantly, they have the same treatment and long-term health. COPD stands for Chronic Obstructive Pulmonary Disease. It's a broad category of diseases that affect your breathing. I myself have asthma. It's kind of a funny story. I diagnosed myself when I was in medical school. Throughout my childhood, I had asthma, I had symptoms. I just didn't know what it was, and I thought it was just the way people had to live. So when I found out I had asthma and I started treating myself, it was a real changing point. So I think it's really important for me to help educate patients so they understand what it is and to help better manage it. The main cause of COPD is smoking. Not everyone that has COPD smokes, but the vast majority do. Smoking causes damage to your lungs and decreases your lung function at a much faster rate. The good news is if you stop smoking, your lung function starts decreasing at a much lower rate. So if you've smoked before, it's essential if you have COPD to stop smoking because you can help decrease the rate and live a longer, healthier life. Another leading cause of COPD is air pollution. Limiting your exposure to air pollution is also an important strategy to keeping you healthy. So what are the symptoms of COPD? It can be shortness of breath with everyday activities. It can be chronic cough with mucus. It can be chest tightness. It can be frequent lung infections, and it can be wheezing. The mainstay of treatment for COPD and asthma is steroids and bronchodilators. Steroids help decrease the inflammation, and bronchodilators open up your airways. Both are given as an inhaler, so they both improve your lung function. One of the biggest things about inhalers is using them appropriately. I want to spend a little time talking about how to use an inhaler. You're supposed to shake it. You're supposed to go 2 finger breaths away and then take a big deep. It's pretty hard. That's why I always prescribe a spacer. Putting the spacer in, shaking it, giving the 2 breaths, and taking a big deep breath. You can feel the difference in the amount of medication you get. Using a spacer helps get the medication right where you need it. I want all our members to be on an action plan for COPD and asthma. An action plan defines what your symptoms are and what are the next steps. We want to know when patients are in the red zone. They're acutely ill, they need to go to the hospital, and they need to know what they should take while they're trying to get to the hospital. We want to know when they're in the yellow zone, or they're having minor symptoms that we can treat and hopefully prevent them from getting worse. And we want to know when patients are in the green zone, when things are going well, and what they're doing to keep them in the green zone.
When you've been diagnosed with COPD, your case manager is here to help make things easier. Our case managers can teach you how to use medications, help you get the equipment you need like oxygen or nebulizers, set up an emergency kit, schedule appointments and help with transportation to your doctors, and visit you at home if needed, or just talk on the phone. Just call us. We're here to help you live well with COPD.
Even though I was tremendously anxious, the staff put me at ease. I was comforted, I was coached, I felt tremendous relief, and then not only that, the connection and the coaching to help me progress through this issue. But anyway, it's very comforting to me to have that because, you know, I lost my wife last year. She watched over everything for me. My case manager taught me how to use the inhaler, and she assured me that somebody was going to give me further instructions. It was a tremendous help to me.
COPD and asthma can be a really big diagnosis. It can be overwhelming, but the good news is with treatment, lifestyle changes, you can live a long, healthy life.